All right, we are live, we are live, we are live. So while we are waiting for people to come on, Reverend, can you tell us a bit? Oh, let me just say this. I have a guest today. Her name is Reverend Johnson. She is a registered nurse and she's going to take us today through STDs, different types of STDs, and how you can stay safe because we know that it is rough in these streets. Okay. So, Reverend, why don't you tell us a little bit about yourself?
Sure. Hello, everybody. My name is Raven. I've been a registered nurse for about 6 years now. Um, I started off in the ICU and now I'm doing outpatient in an outpatient setting, dealing mainly with medical and sexually transmitted infections. So I'm very passionate about it. Like Indy said, it's rough in these streets, and I don't want anybody to make their life any rougher than what it has to be. So, yeah, that's about it.
All right, so I'm just gonna get on it with the slides. So, like Revan said, we are going to talk about sexually transmitted infections today. We'll talk about PrEP. PrEP, she'll go into it, PrEP and PEP. And if you have any questions, don't hesitate to put in your questions and we will answer them at the end of the presentation. So, let's get to the next one. So, Revan, the floor is yours.
Absolutely. Thanks, Indy. Okay. So, what is an STI? I know most people know them as STDs, sexually transmitted diseases. But the more proper term is sexually transmitted infection. Because with infections, you don't necessarily have to have any symptoms. With diseases, you normally do. So, STI is sexually transmitted infection. It's an infection can be passed from one person to another through vaginal, oral, and anal sex. They can also be spread through intimate physical contact, like heavy petting, though that's not very common. And if they are left untreated, there can be serious consequences, including blindness, neurological manifestations, infertility, and mother to child transmissions or even birth defects.
All right.
So there are more than 20 types of STDs, but the most common ones are chlamydia, genital herpes, gonorrhea, HIV, AIDS, HPV, pubic lice or crabs, syphilis, or trichomoniasis. Next slide. Okay, so how do I know if I have a sexually transmitted infection? Um, the most accurate way of finding out if you have a sexually transmitted infection is STI testing that you can get done at your primary care physician's office, the health department, your local health department, and urgent care, such as Patient First, or if you have some symptoms. Next slide. So, like I said earlier, STIs don't always cause symptoms, or they may only cause mild symptoms. So, it's possible to have an infection and you not even know it. So, STIs can be caused by bacteria, viruses, and parasites. Some symptoms may include, but are not limited to, some unusual discharge from your penis or vagina, sores or warts in the genital area, painful or frequent urination, itching and redness in the genital area, blisters or sores in or around your mouth, abnormal vaginal odor, anal itching, soreness or bleeding, abdominal pain, or even fevers. And the next slide, you can go to the next slide. The next slide are just some pictures of examples. So the picture of
Hmm.
the hands is secondary stage syphilis. Um, when it comes to syphilis, you may most times you'll see the rash on the hands as pictured, um, or the rash may be on your abdomen, or it could be the rash could show up anywhere. And also maybe like a canker sore on the penis or in the genital area. Oral thrush is another one, which is what you see in the top right hand corner. And in the bottom right hand corner, we see HPV, genital warts on a penis. And those are just some. Next slide. Are STIs treatable? Most, I think it's important to note before treatment that most STIs are preventable. So you don't even have to get to the part.
That's an important point.
So the most important thing is they're preventable. The use of female or male condoms, vaccines such as the HPV vaccine, it is available to men and women. I know in the past it was only available to women, but it is available to men. Abstaining from sex altogether, if you can handle it, just don't have sex. Reducing your number of sexual partners, it will take you out of that high risk category. Mutual monogamy, meaning you and your partner, y'all have agreed to only have sex with each other. And prophylaxis, which is what we will get into in other slides. Antibiotics can treat STDs caused by bacteria or parasites, but there is no cure for STDs caused by viruses, such as HIV, AIDS, and herpes. But there are medicines that can often help with the symptoms and lower your risk of spreading the infection to other people. One of those medications that lower your risk of spreading HIV or AIDS to other people is, we can go to the next slide, is PrEP. What is PrEP? PrEP stands for pre-exposure prophylaxis. Okay, prophylaxis is the use of medications to prevent the spread of disease in people who have not yet been exposed to a disease causing agent, usually a virus, because again, viruses cannot be cured. The term typically refers to a specific antiviral drug as a strategy for HIV/AIDS prevention. So, PrEP is essentially two HIV medications put into one pill. It has been approved by the FDA um, as used for prophylaxis. There are two different kinds of PrEP pills, Truvada and Descovy. And then PrEP is most effective when it is taken consistently on a daily basis. Next slide. All right. So, who should take PrEP? PrEP is used by people without HIV. So, as long as you're HIV negative, then you can take PrEP. Um, and also people who are at risk of being exposed to HIV through sex or injection drug use. Um, so, if one has a sexual partner with HIV, especially if that partner has an unknown or a detectable viral load, or if you have a history of condom breakage, or if you've been diagnosed with a sexually transmitted infection in the past 6 months, PrEP would be a good idea for you. It's also recommended to people without HIV, again, who inject drugs, who have a injection partner who has HIV, or they don't know if their injection partner has a HIV. And if you are sharing needles with anybody, needles, syringes, or any type of equipment that you would use to inject drugs, PrEP would be good for you. Because if a person is exposed to HIV through sex or injection drug use, having PrEP medicine in your bloodstream can stop HIV from taking hold and spreading throughout the body. But if you do not take your PrEP every day on a daily basis, around the same time, give or take an hour, we're not perfect, there may not be enough medicine in the bloodstream to block the virus. So that's why it's extremely important to, if you do decide to take PrEP, take it every day. PrEP should also be considered for people without HIV who have been prescribed non occupational post exposure prophylaxis, or PEP. And we'll get more into what PEP is. Okay, so the CDC reports that studies on PrEP's effectiveness have shown that consistent use, that's the important thing, consistent use of PrEP reduces the risk of getting HIV from sex by about 99%. That's almost
That's
100
right.
chance of not getting HIV, especially
Mm-hmm.
if you practice high risk behaviors such as multiple sexual partners. Some people just don't like the way condoms feel. That's your thing. Or if you practice injection drug use and you share needles or syringes. All right. But it is important to continue to use condoms while taking PrEP, because even though daily PrEP can decrease your risk of HIV, it does not protect you against from the other STDs that we talked about earlier. So you can still get chlamydia, gonorrhea, HPV, herpes, all of those. You can still get those. And also, if you were to come in contact with another sexually transmitted infection, it reduces the effectiveness of PrEP. But we'll get into that as well. You can go to the next slide. So, with PrEP being 99% effective, what's the catch, right? What's
Mm-hmm.
what's going to happen to me? And am I going to grow a third leg? No. So, possible side effects of taking PrEP. Um, and I say possible because just because they're side effects, it doesn't mean everybody experiences them. Okay, these are just possible. 9 times out of 10, it don't even happen to you. So there's some GI upset for about 7 to 10 days, some nausea, some upset stomach, loose bowels, diarrhea. But it's important, even though you have those symptoms, still take your PrEP consistently. Those symptoms usually fall off on day 10, like it never happened. And for some, it can decrease their kidney function, but that's why it's important to make sure you go to your appointments every 3 months, get your labs done every 3 months, because if those kidney levels start to go up, we'll catch it right away. But we'll get into adherence and all of that later. Next slide. So now that you've come to the thought of, okay, I can deal with a little bit of loose bowels for a couple of days. My kidney's pretty good. I drink my 64 ounces a day, so my kidneys are good. How can you get PrEP? So, for one, you want to make sure that you're ready to commit to taking a medication daily at the same time. Because if you aren't ready to take a medication daily at the same time, you run the risk of becoming resistant to PrEP. And we don't want that, because then it just won't work for you. Um, Another way that you can get PrEP is speak with your provider. Visit the your local health department and make sure that you are ready to uphold your scheduled provider visits and your lab appointments. Because, like I said, we want to make sure that you don't have any other STIs, and we want to make sure that your kidneys are still functioning properly. And I guess it's important to note the reason that we want to check on your kidneys is because PrEP is processed through the kidneys. Okay. Truvada more so, Descovy not much, but that's the what depends on if you get Truvada versus Descovy is dependent on your insurance. But most of the time Descovy is approved, which basically doesn't have that much of an effect on your kidneys at all. So yeah, just make sure that you're ready to commit to something like that before you just decide, oh yeah, I just want to get into PrEP. No, make sure that you're ready to take something every day at the same time and go to your appointments. All right, next slide. So this is when you all heard me talk about PEP in the previous slides. So what if I'm exposed to HIV and I'm not on PrEP? Then what? So, I mean, not everybody knows about PrEP, and you may get yourself in a situation where the condom broke, or you shared a needle with somebody and you didn't know who they were, or maybe you had a one night stand and the next morning you realized you were blocked on everything. So, in those cases, there's a 72-hour window where you should talk to your healthcare provider or an emergency room doctor or an urgent care provider about PEP, which is post exposure prophylaxis, if you think you may have been exposed to HIV. Okay. Um, the sooner you start PEP, though, the better. Every hour counts. If you are prescribed PEP for post exposure, you will need to take it daily for 28 days. And then it will probably be a good idea if you practice high risk behavior to switch over to PrEP after PEP. In the last slide, PEP is for emergency situations. It is not meant to be used daily like PrEP. It's only given for possible exposure to HIV. Um, it is not the right choice for people who may be exposed to HIV frequently. If that's the case, then you need to get on PrEP. If you're at an ongoing risk for HIV, such as through repeated exposures to HIV, then you really want to talk to a healthcare provider about PrEP, pre exposure prophylaxis. But that's it. That concludes my presentation on STIs, PrEP, and Pep Talk. I'm open to any questions.
So, when you were talking, I kind of wrote some key points down that I wanted to just put out there based on the things that you said. Um, Going back to, I think, slide two, which is the different kinds of, was it? Okay, maybe slide three, the different kinds of STIs. I just wanted to make a keynote on genital herpes because most people don't know that genital herpes is cannot be permanently cured.
Mm-hmm.
Just so you know,
Yeah.
when once you have herpes, you have it for life. Um, and those are the ones that cause blisters in the genital areas and the buttocks areas, and it can show up on your thighs. Your sometimes they have oral herpes. It can come up on your mouth, and because I had someone ask me a question, like when I posted this and I said, oh, we have a presentation on STIs, and somebody sent me a question saying, oh, I know this person that has these blisters that comes and goes. Um, and it hurts, it itches, it'll come and then it'll go away. And now the wife has the same blisters. So I just want to put it out there. If you have genital herpes in the description, I just knew that it was herpes. Herpes will come and go. So you have the blisters, especially when your body is under stress. That's when the blisters will come up. There are medications, antiviral drugs that can be given to slow down um, complications, or the longevity of the breakouts. They are called breakouts. Every time you have a blister that comes up, it's called a breakout. So you can slow down the frequency of your breakouts, but it cannot be cured. When once you have it, you have it. And when you have an active breakout, you should not be engaging any you should not be engaging in any sexual activity with someone, because the infection spreads through the fluids in the blisters. So that's probably why the person's wife had it,
Mhm.
because probably was engaging in things while having an active breakout. So when once you have an active, you should be staying away from anybody, because that's how you spread it. And also, there are medications that can be taken if you're having too much of a breakout. Let's say every 3 months, if you have more than five a year, you should really talk to your healthcare provider, because there's a medication you can take every day to prevent you from having it so often. So I just wanted to put it out there. Some of them, like she said, gonorrhea, syphilis, chlamydia, those can be cured, but that doesn't mean that you keep exposing yourself over and over again. That's why she said that the best cure is prevention. Just don't get it.
Mhm.
Uh, Another thing is that your local health department will give you a free STD test. Okay. So if you go to your local health department, they can test you for free if you live in PG County, if you live in Anne Arundel County, wherever you live, you can go to the health department. If you're back home, like in Nigeria, if you go to a public hospital, I'm pretty sure you have to pay, but I don't think it's going to be that much, but you can get tested. And here, your local department will treat you for it too, for free.
Yep.
If you have STI, trust me, they will call you. Reverend knows, they will come to your door
It
and they
will
will knock your door.
go until you come with me.
Yes, we need to treat you because you got something and we don't want you spreading it all around. Because
Yeah.
the thing is, some people have it and they don't have symptoms. Like she said before, that's why it's called an infection. You can have it and spread it around with no symptoms. People get tested and they come up positive on a routine test.
Hmm.
And they're like, but I don't have any symptoms. You don't, but you're giving it to other people if you don't get treated. And whoever you've been in contact with, they need to be notified. They need to be tested and treated. Because,
Yeah.
like she showed us a picture of a secondary syphilis, that's what happens if you don't get tested and treated. Syphilis can cause so many, there you go, so many other issues, including your heart. It can affect your heart. You don't want it staying too long inside of your body. It can give you neurological deficits,
And it can
memory loss. Yep, all
ultimate.
of that.
Yep.
Yep, all of that from an STD. So please get treated. If you see a weird blister on your body, if you see a weird rash, the rashes on syphilis, most of the times it comes on your palms. They painless. They're just there. Sometimes, you know, anything that looks weird, please get tested. Um, she talks about PrEP. So PrEP, she talks about the two medications for PrEP. Another thing to note is that if you're having a side effect on one medication, like she said, the 7 to 10 days, it usually will go away. But if it's past 10 days, you're still having symptoms and it's really bothering you, if you were taking this COVID, your doctor can always try to change to Truvada and see how you feel on that. So there are options. And I think there we have injections now that
Yes.
that you can take once. Is it once a month?
It's once a month or once every other month for prep.
Hmm.
Mhm.
That can prevent you from HIV. Even HIV medication now, they have an injection once a month or once every other month that you can take if you do have HIV, that can keep you from spreading it to other people. Because If you have HIV, you can, if you take your medication every single day, you can become undetectable, which
Mm.
means that at that point that you're undetectable, you can no longer give it to someone else. And that means that your viral load has to be less than 20 copies for you not to spread it. And you can achieve that with consistency and taking your medication every day. But why would you even want to get there if you can prevent it? Because like prep is like literally like birth
Yeah,
control pill. You have to take it at the same time or close to the same time every single day for it to be effective. If you don't take prep, whether you're on Descovy or Truvada, if you don't take it every day at the same time, you can be literally lying to yourself, because you can still have HIV if you're not consistent.
yeah,
The main key is being consistent in taking the medication every single day and on time, getting your labs done to get your kidney function checked to make sure that everything is still working out for you. And if you by any chance get a needle stick at work, maybe
mm-hmm.
you at work and you got a needle stick, it's from a dirty needle, or you don't know if the patient has HIV or not. Usually your job will get a consent from that patient to run tests on the patient, but you have the right to request treatment, which
Yep.
means they're going to send you for some blood work and they can start you on medication, which is PEP, the
PEP.
post exposure, which means you've been exposed, or maybe you had sexual intercourse with someone and you don't know the status of the person, which at this point you should be asking someone for the sake of your health, do you have HIV or not? Which, again, prevention is better than cure. Okay. So if you don't do it, then it's even better if you save yourself of the stress of having to take a medication every day for the rest of your life, or an injection. So you have to use condoms at all times. As a Christian, I would tell you, you should not be engaging if you're not married, but hey, it's not my place.
As a
So
Christian who is not married, I understand that sometimes y'all do what y'all got to do. Nobody.
mhm,
But another important thing to note is because PrEP is processed through the kidneys and everything, if you're worrying about, oh, back in the day, my doctor said something was up with my kidneys, that doesn't necessarily mean that you can't take PrEP. It just means that you need to go back to your provider, get those kidney tests run again because the kidneys cure themselves often, very often, just to make sure that your kidneys are suitable for PrEP. And like I said before, if you do have a kidney issue, then that means that you're more suitable for Descovy versus Truvada. So you have options.
okay. So what would be like your final advice to round it up for people? And of course, if anyone has any questions, please don't hesitate to put in your questions. We will answer. Um, Reverend will answer any questions that you have. But Reverend, what would you tell people based on the kind of job that you do and what you have seen? What would be your advice to people?
My advice would be to put yourself first. Know your status for yourself first, and anybody that you come in contact with and plan on laying down with, know their status as well. If anybody wants to negate you or argue with you about their status, do not lay with them. Do not lay with them. It is not worth it. So put yourself first, know your status, be honest with yourself, and protect yourself, whether it be through 100% condom use, because condoms do work, or through getting PrEP. Just protect yourself. I've seen too many situations where people are in monogamous relationships and for years, and somebody pops up with an STD.
Hmm.
And there's no guessing of how that happened. You cannot get an STD off of a toilet seat.
Oh my goodness.
Let anybody tell you you can get an STD off a toilet seat. That person that you lay down with gave it to you, not the public restroom. I, and that's it.
All right. Thank you. Thank you so much, Reverend. Where can anyone find you?
I'm on Facebook, Raven Johnson. You see the spelling on the screen. My Instagram is all the rave, ALLTHERHAV is in Victor. It's a safe space. I love talking about STDs and sex and stuff, honestly, because it's what's going on in the world today. And I don't think a lot of people take sexual health as seriously as their regular health. So it's important. It's important because your sexual health can affect your mental health as well. So
Absolutely.
ask and I'll be, and if I don't know the answer, I promise you I'm going to find out.
Yeah. Wow. Thank you. Thank you. Thank you so much. It was a pleasure having you. And if anybody has a question, like she said, you can always reach out to her. You can reach out to me in any way that we can be of help. We will help. Thank you all so much for joining me. And I hope you guys have a beautiful, beautiful Saturday. Until next time, bye.